Hi, my name is Iyasu Agawi, and I will be doing a presentation on the health in Brazil. This presentation will go over various things such as the accessibility to medicine all the way to the potability of water. So first things first, a small history of Brazilian medicine. Traditional Brazilian medicine includes many South American elements and incorporates traditional African elements as well. Traditional medicine was often practiced in the northeast regions of Brazil, which will include the region of Manaus, which we will be traveling to, so that is relevant, and other areas include nearly all landlocked regions of Brazil. So this includes most of the Amazon as well as some of the northeastern coast. So an interesting aspect of traditional Brazilian medicine is that it was practiced by Black Native American mestizo people. And here on the right, we have the cashew plant, and some of its elements were often used in these medicinal practices, such as the bark and the seeds. Continuing forward, the accessibility to medicine in Brazil. So first things first, if an emergency were to occur, calling 192 will get you an ambulance. So that is very, very relevant to know. The metropolitan areas of Brazil do have really good medical care. So that's something one would not really need to worry about. But when going to rural regions such as Manaus, you need to be more aware that this medical care and accessibility will be a lot more limited. When it comes to foreigners or people without insurance, aka non-Brazilians, making a doctor's appointment would be kind of expensive since essentially foreigners are not covered under the unified health system, which covers all Brazilians for free and for basic medical assistance such as treatments and surgeries. However, if you want to make a special appointment or a médico particular, you're going to have to pay higher fees to see a private doctor. So when it comes to the facilities and sanitation of Brazil, you can see an obvious or a difference in standard. So when it comes to 81.3 of the population, they do have access to improved facilities. These improved facilities are facilities such as toilets, showers, etc. And the factor that makes them these will categorize them under improved facilities are that they do have a connection to a sewage system. Now, this chart right here only applies to urban areas. Only 52% of Brazilians have access or improved facilities in rural regions, meaning that the infrastructure of a sewage system does not necessarily apply to them. Now, what does improved facility means? It means that the facility has adequate access to disposal facilities and the prevention of human, animal, and insect contact or contamination, and that they are regularly checked upon as well as cleaned. In 2015, 35 million people were without access to these improved sanitation, and 83 of the population had access to these. Moving on. So infectious diseases in Brazil are going to be one of the main things that one would have to essentially worry about. And that's because there are quite a few of them, and some of them are not, just your average flu. So for example, the dengue fever, that's a big one to worry about. It is transmitted by the Aedes mosquitoes, which bite frequently during daytime and are more common in densely populated urban environments. So when we're in São Paulo or also in Rio, that's something to be very mindful of. The symptoms that this dengue can cause include fevers, muscle aches, headaches, and there are no vaccines or treatments for it. So what one would have to do is apply a lot of mosquito repellent with DEET as an active ingredient, and also drink a lot of liquids just to stay just to reduce the likelihood of contracting it. Now the second one, malaria, also a big one. So if you look at this map here of Brazil, this is the map where malaria is more is densely located essentially. So malaria is also transmitted by a mosquito bite, and these mosquitoes usually are active in the dusk and dawn time. So before going to bed, waking up in the morning, it is very crucial to apply this mosquito or bug repellent with DEET as an active ingredient. Some of the symptoms that one may experience if contracting malaria are spiked fevers, chills, and sweats, and it usually has to do with the central nervous system, which can sometimes lead to seizures and confusion. So taking malaria pills is highly recommended when traveling to this region, especially for our group who are not accustomed to such a disease essentially. So that would be a great thing to take care of. Another one is typhoid. Typhoid is a fever caused by ingesting food or water that's contaminated by a species of salmonella. So another, for typhoid, you will experience symptoms of a fever-like symptom essentially. And to avoid getting typhoid, one should be very mindful of the meals and liquids that one takes in. So if you are you need to know, hey, if I'm in or if you're in a restaurant versus kind of like a street food area, know your surroundings, look at the sanitation of the place, and also getting the typhoid vaccine would be a good idea just to be on the safe side. Now yellow fever, as you can see down here, I have a map of the yellow fever. As you can tell, Brazil is essentially plagued by yellow fever. This is a map from 2007, as well as predominantly Central Africa is also plagued by it. But again, Manaus is in this contaminated, essentially, region. So yellow fever is a viral infection that can also be transmitted by mosquitoes. So again, the bug repellent with DEET as an active ingredient would be a great choice. So there's no treatment for yellow fever. Therefore, a vaccination would be highly recommended for travelers who are going to regions such as the Amazon. It is not necessarily required for the urban tourists, such as those who visit Rio and Sao Paulo, but because we're going to Manaus, it would be highly recommended. Lastly, we have hepatitis A and hepatitis B. Hepatitis B can be transmitted through sexual contact or contaminated needles. So just being mindful of that is a good thing. And it is also somewhat prevalent in Brazil. Hepatitis A, on the other hand, can be contracted by food or contaminated water. So again, being mindful of where you are, what you're eating, would be a great thing to do. Lastly, we have in the kind of diseases and infection sections, we have HIV and AIDS. So HIV and AIDS is an epidemic that is kind of more or less prevalent in Brazil, especially in the urban areas. So, but it is considered stable on the national level. However, 0.6% of the population has contracted either HIV or AIDS, and Brazil accounts for 40% of all HIV and AIDS infection within South America as a whole in that region, within Latin America. AIDS is prevalent in 4.9% of female sex workers, as well as 9.9% of injection drug users. Again, these stats, the majority of these stats come from very densely populated sections of the country, such as Rio, such as Sao Paulo. So it's mindful to know these numbers when going out and exploring the nightlife of Brazil. So lastly, I have the excess of potable water. So 98% of Brazilians have access to improved water, while 4 million do not. Access to piped water stands at 92%, and this was recorded in the year of 2010. The infrastructure is more common in urban areas since 88% of the population lives there, and 100% of the urban areas have water coverage, or the stats show that 100% of the urban areas do, while only 85% of rural areas do. And reaching poor urban neighborhoods still remains a challenge in Brazil, such as the favelas, even though they're often located near a urban area, because they're sometimes built on a very steep slope, for example. It is hard for the Brazilian government to create the infrastructure needed to give these favelas the access to potable water sometimes. So something that needs to be, thought about when going to Brazil. When in Manaus, there'll be essentially less potable water. So one needs to be mindful of where they're getting their drinking water from. That's why, again, I've said this before, that one should only, if they can, only drink out of bottled water. If this is really not, if this can't be done, essentially, boiling water for a minute, at least a minute, I should say, getting a water filter, getting an ultraviolet filter, or using iodine pills would be a second option. But the best option is still to get bottled water, know where your water is coming from, and always use a glass which has been washed, because sometimes when you purchase a bottle of water, these bottled water may be kept in back of house, where the standard of sanitation isn't that of the United States, obviously, so there may be some contamination with perhaps rodents and whatnot. This is all I have for you guys for today. Thank you so much for watching, and I hope you learned something. Thank you very much.